So the recording is started now. Right. So I welcome you all again in our today's session, and that is related with the supporting individuals in adult social care. And we will discuss the learning outcome number 3, which is understand safe practices in adult social care. So just for a recap and to start the lecture, I'll begin what happened in adult social care. Uh, it's our duty to ensure safe and effective practices is ever really important in supporting individual well-being and maintaining a high standard of care. And we have discussed some important consideration to understand safe practices in adult social care previously. Like, for example, few of the important ones are risk assessment. So, uh, risk assessment means conducting comprehensive risk assessment. It's essential to identify potential hazards, and we need to assess individual needs and implement appropriate safety measures. What it does, this helps in preventing accidents, minimizing risk, and ensuring a safe environment for individuals who are receiving the care. And in the meanwhile, if any one of you have any question, then please do ask me the question and I'll try to answer your questions. The second bit, which is important in adult care, is safeguarding vulnerable adults, and it means like understanding safeguarding protocols and procedure. It is crucial to protect vulnerable adults from abuse, neglect, or exploitation. We need to recognize signs of abuse and reporting concerns and following safeguarding guidelines are essential components of safe practice in adult social care. Then we have infection control. Implementing effective infection control measures is vital to prevent the spread of diseases and maintain a hygienic environment. Practices such as hand hygiene, proper sanitation, and use of personal protective equipment, PPE, and what they does is they help reduce the risk of infection in social care settings. Then, as a care provider, we need to look for the medication management as well. So in medication management, ensuring safe medication management involves accurate administration, storage, and recording of medicines in accordance with the individual care plan. That is very important, and the staff should receive proper training on medication administration and follow proper protocols to minimize medication errors and promote individual safety. Then important bit is health and safety. So adhering to health and safety protocols, which include fire safety procedures, risk assessments, and safe manual handling practice is crucial to maintaining a safe environment for individuals and staff members. Regular health and safety training and audits help mitigate risk and ensure compliance with the regulations. So health and safety is really important in health and social care industry. Then upholding individual rights, dignity, and privacy is also fundamental to safe practices in adult social care. Respecting individual choices, preferences, and cultural beliefs, and promoting person-centered care contribute to creating a safe and supportive care environment. So, by understanding and implementing safe practice principles in adult social care, caregivers can enhance the quality of care, safeguard individuals' well-being, and uphold ethical standards in supporting vulnerable adults. As a staff, continuous training, regular assessment, and a commitment to person-centered and respectful care are essential components of safe practices in adult social care. So these are the important bits which involve in the safe practices in adult social care. So we'll move to the next slide. Okay. So in the next slide, we have a list of indicative content, and in that we have few bullet points. Uh, First one is the responsibilities for safety in care. The second bit is the importance of following policy and agreed ways of working. Then we have safe use of equipment and just for example, following manufacturer instruction and agreed ways of working. Then we have areas where specialist training may be required. For example, equipment, use of equipment, first aid, fire safety, food safety, moving and handling, administration of medicine, healthcare procedures, and why training required, consequences of poor practices, limits of own responsibility. We have discussed everything previously in detail as well, so we'll discuss these as well in today's lecture. Then safeguarding practice, awareness of signs of abuse, risk factors, responses to abuse, and allegations of abuse. Then we have comments and complaint system, for example, importance of complaints policies and what they should include. So this is from the indicative content. Then, right, few other points we need to discuss as well, which include risk assessment and what is a risk assessment, identifying hazard and risk in relation to care activities, responsibilities for risk assessment, who contributes to risk assessment, for example, staff, service users, carers, family, and other professionals. We discussed this as well in our previous lectures as well, like the multidisciplinary or interdisciplinary teamwork. Then we need to know the concept of managing risk controls in place to eliminate or reduce risk. Then we have positive risk taking, importance of supporting service user to manage risk in choosing activities, service user choice to take risk. Then we have to um, discuss about the dilemmas, conflicts between service user rights and duty of care or risk. Then we have importance of security in health and social care setting. Example, preventing access of unauthorized persons to care setting, security in relation to service user belonging and confidential information. Then infection control practices, policies, and ways of working. Then we have restrictive practice, how to avoid when this might be acceptable, and staff safety. So these all are the important bits which we need to discuss in the learning outcome number 3. Now we'll move to the next slide. Right. So in this one, we have to explain the management of risk in adult social care. So we have risk identification. Okay. So risk management is a crucial aspect of maintaining a safe environment in adult social care setting, and a comprehensive explanation of the key aspects of risk management. Uh, it starts with risk identification. So risk identification is the foundation step in risk management, involving the recognition and examination of potential hazards and risk within adult social care setting. These risks can encompass a variety of areas, which include physical hazards. Um, in physical hazards, what we need to do is identifying risks such as uh, slippery floors, um, poor lighting, and for example, poor maintained equipment or obstacles that could lead to slips, trips, or falls among service user or staff. Then we have to look for the uh, recognizing hazards related to infection control, improper handling of medicines, uh, exposure to harmful substances, or unsafe practices that may compromise the well-being of individual in care. So we need to look for the health and safety risk. Then safeguarding risks are important. We need to identify risks which are associated with abuse, neglect, exploitation, or violation of individual rights, and implementing measures to protect vulnerable adults from harm. Then we have uh, environmental risk as well. So we need to consider factors such as building safety, emergency preparedness, fire hazards, and environmental conditions that could pose risk to the health and safety of individuals and staff. By conducting thorough risk assessment and actively identifying potential hazards in adult social care setting, organization can proactively address risk, implement preventive measures, and create a safer and more secure environment for service users and staff members. So again, I'll remind you all that if you do have any question, then please ask regarding any content which we are discussing today. Right. So again, it's the continuation of the previous slide. So we have risk assessment and risk mitigation strategies. Okay, so as we discussed earlier, so risk assessment is a critical process that follows risk identification and involves evaluating the severity and likelihood of potential risk. Factors such as vulnerability of service user, types of activities or intervention being carried out, and staff competency levels are taken into account. In risk assessment, the objective is to quantify and prioritize risk based on their potential impact on the well-being of service users and staff. So it involves both. By systematically assessing risk, organization can understand the level of risk exposure, identify critical areas requiring attention, and develop targeted risk mitigation strategies. So now if we discuss about the risk mitigation strategies, what we do in that after conducting risk assessment, the next step is to implement risk mitigation strategies to reduce the likelihood of risk occurring and minimizing their impact. This involves putting in place control measures and intervention to address identified risk effectively. Examples of risk mitigation strategies in rural social care could include um, implementing safe working practices and protocols to ensure the physical and emotional well-being of service users, then providing comprehensive training and supervision to staff on best practices, risk management, and emergency procedures. We need to ensure that appropriate equipment, resources, and support system are available to support staff and effective care delivery. And then we have regular monitoring, audits, and reviews to assess the effectiveness of risk mitigation measures and make necessary adjustment based on the feedback and the outcomes. And if we implement risk mitigation strategies, organization can proactively manage risk, enhance the safety and quality of care, and create a supportive and secure environment for service user and staff members. So these all are the important points. Then we have the next slide, person-centered risk management and documentation and record keeping. Right. So person-centered risk management involves considering the specific needs, preferences, and goals of individual when managing risk. So this approach aims to balance the risk and benefits of different options while actively involving service user in decision making regarding their care and support. Then documenting and record keeping. So documenting and record keeping, these are very important or crucial aspect of effective risk management. It is necessary to record risk assessment, the control measures that have been put in place, incidents and accidents that occur, and any changes in the level of risk over time. Keeping accurate and up-to-date records is vital for monitoring and evaluating risk as well as ensuring accountability within the system or the organization. So now we move to the next slide. So now we have regular review and monitoring and multidisciplinary approach. Right. So regular review and monitoring are essential components of effective risk management, and this process should be ongoing and include periodic reviews of risk, particularly when there are significant changes in circumstances or new information that becomes available. Monitoring allows for adjustment to be made to risk management strategies as necessary to maintain their effectiveness. And we have multidisciplinary approach, right? So in adult social care, a multidisciplinary approach to risk management is necessary, and this approach involves collaboration between various professional and agencies to ensure that risks are assessed from different perspectives and intervention are placed efficiently or effectively. And it may entail working with healthcare professionals, social workers, family, and other stakeholders to address the risk comprehensively. So this is under the multidisciplinary approach. Then move to the next slide. Right. Then we have to discuss about the safeguarding and incident reporting. Okay. So safeguarding and incident reporting, again, it is essential. Uh, for example, if we have a scenario, so um, a scenario could be like where a care worker notices bruises on a service user during a routine visit. So this observation raises concerns about potential abuse or harm. In this case, the care worker must follow safeguarding procedures by reporting the incident to the appropriate authorities or designated safeguarding officer. Then, uh, why we have to do that? It's like safeguarding is an essential aspect of risk management in adult social care, as it aims to protect service user from harm, abuse, or neglect. And when incidents or any concern or allegation of harm arises, it is crucial to have a proper reporting procedures in place, and we need to do the staff need to do the prompt reporting and investigation of such incidents are necessary to address the risk effectively and ensure the safety and well-being of service user. And by taking timely action and implementing preventive measures, caregivers can mitigate risk and maintain a safe environment for those under their care. So these all are the important aspects of safeguarding and incident reporting. Right. So we need to do the conclusion. So um, in summary, we can say that effective risk management in adult social care is about prioritizing the safety and well-being of both service user and staff. It involves identifying, assessing, and minimizing risk by adopting a person-centered approach, maintaining thorough documentation, regularly reviewing and monitoring risk, and fostering collaboration among professionals and implement robust safeguarding procedures. By integrating these practices, adult social care settings can establish safe environment and promote high quality care and support for service users. So that was the conclusion. Moving on to the next slide. So now we have to analyze safe practices in adult social care and health and safety policies and procedures. Right. So in that we can say in adult social care, ensuring safe practices is again paramount to the well-being of service users, staff, and any other person who's involved in the care. And we need to analyze key aspects such as health and safety policies and procedures. It's like fundamental to maintaining a safe environment. This when we analyze these and what we do, this analysis entails reviewing protocols for hazard identification, incident reporting, risk assessment procedures, and the implementation of control measures to minimize and manage risk effectively. By thoroughly assessing and understanding these policies and procedures, care providers can create a secure and supportive setting for all individuals within the care system. We have to move to the next slide. Right. So in the next slide, we have to discuss about staff training and competency and infection control measures. Right. So analyzing staff training and competency as well as infection control measure are important components of safe practice in adult social care. For example, if we discuss about the staff training and competency, so understanding the training programs for staff is vital in ensuring they are equipped with the necessary knowledge and skills to maintain safe practices. By analyzing the training provided, particularly in areas such as health and safety protocols, infection control, manual handling, and safeguarding, what one can assess the staff preparedness to handle various situations. And it's also important to review the frequency of updates and refresher courses to ensure staff's continued competency in these critical areas. Then if we discuss about the infection control measures, so it includes examining the implementation of infection control measures for preventing the spread of infection within adult social care setting by analyzing protocols such as hand hygiene practices, proper utilization of personal protective equipment, PPE. Like after COVID, it is like we all, mostly we people know about the PPE. Then cleaning and disinfection procedures are important, and when isolation protocols are needed, and one can evaluate the effectiveness of these measures in maintaining a hygienic and safe environment for service user and staff. Regular assessment and adjustment of these practices are necessary to uphold high standards of infection prevention and control. So these were all important aspects of the staff training and competency and infection control measures. Now moving on to the next slide, we have medication management and risk assessment and management. Right. So by analyzing medication management procedures and risk assessment and management procedures, uh, there are some aspects of it in like this is a crucial aspect as well, and what it does, it ensures safe practices in adult social care. So that's why these like procedures are very important. Then if we discuss about the medication management, so in medication management, examining procedures for medication management is like essential to guarantee that safe handling and administration of medicine within adult social care setting, and analysis of protocols related to medication storage, administration practices, and accurate documentation and monitoring for adverse reaction or errors is crucial for maintaining the well-being of service users. By assessing these protocols thoroughly, caregivers can ensure that medication are handled safely and administered accordingly and correctly according to an individual care plan. Then we have risk assessment and management. So, okay, uh, analyzing the risk assessment and management process is a key to identifying and addressing potential hazard in adult social care environment. By evaluating risk associated with activities, environment, um, service user health condition, and other factors, caregivers can implement appropriate control measures to minimize these risks effectively. And this analysis enables caregiver to develop a tailored risk management strategies that enhance the safety and well-being of service user and contribute to the overall quality of care provided. Again, students, if you have any question, please don't hesitate to ask. Now, moving on to the next slide. So we have safeguarding procedures and person-centered care planning. So again, person-centered care planning is really important in health and social care. So analyzing safeguarding procedures and person-centered care planning processes are essential for maintaining safe practices in adult social care. So if we discuss about the safeguarding procedures, then evaluating policies and procedures for safeguarding is crucial in ensuring the protection of vulnerable adults from abuse, neglect, and harm. Analysis of safeguarding protocol should include a review of mechanism for recognizing signs of abuse, reporting concerns, and conducting investigation in compliance with legal requirements and guidelines set by local safeguarding boards. Thorough analysis help establishing a robust safeguarding framework that emphasizes the safety and well-being of vulnerable adults. Then, if we discuss about the person-centered care planning, so analyzing the process of person-centered care planning is essential for promoting safe and individualized care practices in adult social care setting. Careful examination of care planning procedure should focus on the involvement of service user in decision making, consideration of their goals and preferences, and the integration of risk assessment and safety measures into care plans. And by ensuring that care plans are tailored to the unique needs and requirements of the service user, what we can achieve is as a caregiver, we can enhance the quality of care provided while prioritizing their safety and well-being. So these all are the important aspects. Moving on to the next slide. Right. So in this one, uh, we have communication and teamwork. Then we have incident reporting and learning, and so right. So in this one, analyzing communication and teamwork protocols along with incident reporting and learning processes again are very crucial in maintaining safe practices in adult social care. So because we are talking everything in the context of adult social care, so evaluation of communication protocol are vital to facilitate clear and effective information exchange among staff members, service user families, and stakeholders in adult social care setting. And analysis of communication procedures should emphasize the importance of clarity, accuracy, and timelines. And It also involves sharing information to support coordinated care delivery. And we also look for fostering a culture of teamwork and collaboration among team members. What it will do is it can affect the um, it can enhance the mutual support and cooperation, and in the end what we'll achieve is a safer care environment for all involved, like the uh, caregivers and the service users. Then, if we discuss the incident reporting and learning, so examining incident reporting and learning procedure is key to ensure a proactive approach to maintaining incident uh, and what it also like involves in that um, we can right. So we were discussing about the incident reporting and learning. So um, if we apply the procedures and we ensure a proactive approach to managing accidents, or uh, like anything which is related with the adult social care setting, and what we need to do is the analysis of incident reporting protocols. We should emphasize the prompt reporting, thorough investigation, and analysis of incident to identify root causes and prevent reoccurrence. And we need to encourage an open culture that values learning from mistakes and continuous improvement. And mm, overall, we will improve the safety practices, and we will strengthen overall risk management strategies by uh, doing the incident reporting and learning. Then we will move to the next slide. Right. So we have um, emergency preparedness, right? So in emergency preparedness, what we do is evaluate the emergency preparedness plan. It involves assessing the protocols and procedures in place to respond effectively to emergencies and critical incidents within adult social care setting. And this includes reviewing plans for evacuation procedures. Uh, for example, we have first aid responses, emergency medical care access, and communication strategies during emergencies. And by analyzing these plans, caregivers can identify potential areas for improvement and ensure the readiness of staff to handle various emergency scenarios promptly and effectively. Um, for example, in the event of a fire emergency in an adult social care facility, analyzing the emergency preparedness plan would involve assessing the evacuation procedures, such as designated escape routes, emergency assembly points, and the roles and responsibilities of staff members during evacuation. And evaluating the availability and accessibility of risk, or the accessibility of first aid kits, emergency medical supplies, and communication devices, ensuring that immediate care and assistance can be provided to individuals in need during such emergencies. And we also like have regular drills and training sessions that can further enhance staff preparedness and ensure a coordinated and effective response to emergencies. Usually we do on a weekly basis, uh, but it depends upon the um, organization where you are working, but usually it happens every once in a week. Then we'll move to the next slide. Right, so we need to conclude that. So we can say that safe practices in adult social care, it encompasses a comprehensive approach that includes robust policies and procedures, continuous staff training and support, infection control measures, effective risk management, safeguarding procedures. We discuss about the person-centered care planning, communication and teamwork, and like if we analyze and improve um, and ourselves and what will happen, these aspects of safe practices and adult social care setting can establish environment uh, that could lead to a safety and well-being of all individuals, and it could create a culture of care and support that promotes quality of life, dignity and dignity for those receiving care. But it also includes ourselves as well as a caregiver. It's for the improvement and safety of both. Then, if we move on to the next slide, right here we have to discuss about this is about the merit criteria, and we need to discuss about how conflicts or dilemmas between individual rights and the duty of care might be addressed. So, right, in this one, we can say that navigating conflicts or dilemmas between individual rights and the duty of care in adult social care setting, it requires a thoughtful and balanced approach to ensure the well-being of service user while respecting their autonomy. So, few of the bits which could include in that are like, for example, um, by encouraging open communication and collaboration between service user, their families, and care providers. It helps in understanding individual preferences, needs, and concerns. And if we foster a culture of transparency and involving service user in decision-making processes, conflicts arising from different perspectives can be mitigated. Then we have adopting a person-centered approach to care allows for individualized care planning that considers the unique values, wishes, and desires of each service user. And by tailoring care plan to align with a service user preferences, who while also addressing safety concern, uh, it makes a balance between autonomy and duty of care can be achieved. Then we discuss about the risk assessment and mitigation, and conducting a thorough risk assessment to identify potential hazard and implementing appropriate control measures. It can help in managing conflicts between individual rights and duty of care. By proactively addressing risk and discussing alternative options with service user, potential conflicts can be resolved while prioritizing safety. Mm, Then we have professional judgment and ethics. It could include in that as well. So uh, we can have guidance and support. Um, we can add these bit into this one, and like what will happen, for example, if we address the conflicts or dilemmas between individual and rights and the duty of care through open communication, person-centered approach, risk assessment in any adult care setting. So what will it will do? Balance the uh, it will balance, and we could give a proper care to a service user, and we will like it's for the betterment of again for both the service user and the staff involved. So these all are the important aspects regarding the conflicts or dilemmas between individual rights and the duty of care. Then move to the next slide. Right. In this one, we have to discuss about person-centered approach and clear policies and procedures. So, for example, if we discuss about the person-centered approach, so for example, there would be a situation where a service user with a cognitive impairment refuses to take medication. So what we could do is instead of imposing the medication against their will, the staff could engage in a discussion with the service user, explore some alternatives, and work collaboratively to find a solution that respect the individual's autonomy while ensuring their health and well-being. Then this is like important person-centered approach. We always discuss um, about the approach where we prioritize the preferences, values, and wishes of the individual. Then, for example, we have clear policies and procedures. So, clear policies and procedures should be in place to guide the staff on how to navigate conflicts and dilemmas effectively. If we give an example, so a policy outlining how staff should handle situations where a service user expresses a desire that may pose risk to their safety could include steps for conducting a risk assessment, exploring alternative options, and um, and seeking input from a multidisciplinary team to make an informed decision that balances autonomy and safety. So if we incorporate both person-centered approach and clear policies and procedures in adult care setting, and what it will give us in return, like it will navigate conflicts effectively and upholding the rights and dignity of service user and ensure their safety and well-being. So these all are the important aspects. Then we have risk assessment and management and collaboration and consultation. Right. So uh, conducting a thorough risk assessment is again like crucial in identifying potential risk associated with an individual choices while maintaining their rights and well-being. Risk management involves evaluating the likelihood and severity of potential risk and implementing control measures to minimize these risks appropriately. And by balancing risk consideration with the individual autonomy, caregivers can help make informed decisions that prioritize safety without compromising the person's independence. Uh, Example could be if we consider a scenario where a service user with mobility issues wishes to continue using the stairs at home independently and despite the risk of falls. So in that case, conducting a risk assessment would involve identifying potential hazards such as uneven steps or poor lighting and implementing measures like installing handrails or offering mobility aids to enhance safety. By involving the service user in the decision-making process and addressing risks effectively, autonomy is respected while safety concerns are addressed. Then uh, we have collaboration and consultation. So collaboration with the service user, their family members, or if they have some advocates and relevant stakeholders is essential in navigating conflicts effectively and consulting with the multidisciplinary team and seeking advice from Uh, Professional experience in ethical dilemmas can offer diverse perspective of values, insights in resolving conflicts. So, by fostering open communication and involving key parties in decision-making processes, consensus can be reached, and what it does, it upholds the individual autonomy and safety. If we think of a example, then suppose a service user expresses a desire to engage in a risky recreational activity that concerns their family members and staff. So what we can do is collaboratively discussing the activity with the service user, their family, and a multidisciplinary team. It will allow for a comprehensive assessment of the potential risk and benefits. And through this consultation process, the alternative, any alternative option or safety measure can be explored to address concern while supporting the individual autonomy and preferences. If we incorporate risk assessment and management procedure uh, with teamwork and consultation practices, adult social care setting can effectively address conflicts between individual rights and the duty of care, promoting a balanced, person-centered approach that prioritizes both autonomy and safety. So all these are the important aspects. Move to the next slide. Right. So in this slide, we have to discuss about the open communication, medication, and advocacy. Right. So um, if we discuss about open communication, so in open communication, we can say that maintaining transparent and open communication is vital for resolving conflicts by ensuring that service user is well informed about their choices and associated risks. By engaging in honest decision and presenting alternative options, all individuals can make decision while understanding the responsibilities of caregiver in upholding their safety and well-being. For example, um, a service user wishes to engage in an activity that poses potential harm to their health. So again, through open communication, caregivers can explain the risk involved, discuss safety measures that can put in place, and explore some alternative activities that align with the individual preferences while minimizing the risk. So transparent dialogue empowers the service user to make informed decisions while considering their safety and well-being. Then we have medication and advocacy. So right uh, in cases where conflicts persist or become challenging to resolve, medication and advocacy services can play a crucial role. So in mediation and advocacy, what we can say that is like mediators, they can facilitate constructive dialogues between the parties involved, and we can try to find solutions that are mutually acceptable and respectful of the individual autonomy. And what advocates can do, advocates on the other hand can represent the voice and interest of the service user, ensuring their rights and upheld and respected through the decision making process. um, for example, like in if a conflict arises between a service user and their family regarding a care decision, a mediator can assist in guiding discussion and finding common ground that considers the wishes of the service user while addressing the concerns raised by the family. And similarly, if we discuss about an advocate, so an advocate can support the service user in expressing their preferences, ensuring that their rights are advocated for and respected in the resolution of the conflict. If we embrace open communication practices and consider mediation and advocacy services when necessary. So adult social care setting can effectively navigate conflicts, promoting collaborative solutions that prioritize the well-being and autonomy of service user while upholding the dignity of care responsibilities. So all these are the important aspects with examples. Then moving on to the next slide, we have training and support for staff, and then legal and ethical considerations. Right. So if we discuss about training and support, so offering training and support to staff is essential for enhancing their skill set in ethical decision making, conflict resolution, and person-centered approaches. And equipped with knowledge and guidance, staff can navigate conflicts and we can address dilemmas effectively and uphold the duty of care while promoting the well-being of service user. Um, for example, suppose a staff member encounters a conflict between a service user autonomy and their safety preferences. So, through specialized training on ethical decision making and conflict resolution, the staff member can encourage in constructive dialogue with the service user, consider all perspective, and collaboratively explore solutions that align with the individual values while ensuring their well-being. So, this training empowers the staff to approach conflicts with empathy, respect, and professionalism. Then we have legal and ethical considerations. Right. So we can say that decisions regarding conflict should align with legal framework and ethical principles. Uh, for example, we can say that Mental Capacity Act, Human Rights Act 1998, like the legislation and professional codes of conduct. We need to consider these legal and ethical aspects and ensure that decisions are made in the best interest of the service user and respecting their rights and autonomy again. Mm, Again, for example, uh, in a complex conflict involving a service user autonomy and safety, staff should refer to legal guidelines such as the Mental Capacity Act. Um, what it will do, we use it to determine the appropriate course of action. By understanding the legal framework and ethical consideration, staff can make decisions that prioritize the individual rights while meeting their duty of care obligation. Seeking legal advice or ethical guidance when faced with any dilemmas. So what it can do is it can provide clarity and ensure that decisions are aligned with legal and ethical standards. So we always need to follow the legal and ethical standards, and by emphasizing training and support for staff on ethical practices, legal and ethical consideration, and seeking guidance when necessary, adult social care setting can effectively manage conflicts and dilemmas in a manner that upholds the well-being and autonomy of service user, and while maintaining professional standards and regulatory compliance. So all these bits are really important. Then we have the conclusion. Right. So, in conclusion, we can say that addressing conflicts and dilemmas between individual rights and the duty of care in adult social care setting, it necessitates a balanced approach that honors the autonomy and choices of service user while prioritizing their safety and well-being. And by embracing person-centered approaches, clear policies and procedures, um, mediation or advocacy we discuss, and we discuss about the staff training and adhering to legal and ethical principles. These conflicts can be navigated thoroughly and effectively while upholding the duty of care. This comprehensive approach ensures that rights, needs, and preferences of service user are respected and protected, and promoting a culture of care, respect, and dignity in adult social care settings. So these all were the important aspects. Then on to the next slide. Right. So we have the references here. Yes, next. Right, okay. So all these were the important aspects related with the learning outcome 3, which was understanding the safe practices in adult social care. Students, please, if you have any question, then please do ask me, and I will try to answer those questions. So we have discussed the learning outcome 3, and it has the merit criteria as well, which we also discussed, which was regarding the dilemmas. This is the merit criteria. So we discuss about the conflicts or dilemmas between individual rights and the duty of care. So I like encourage all of you to attempt the merit and distinction criteria as well in your assignment. So you will have better understanding and you will get a higher grade in your assignments. Don't just only work on the pass criteria. Try to work on the merit and distinction criteria as well. So overall your grades will be improved. So we need to look onto the merit and distinction criteria as well. First of all, we always work on the pass criteria. That is like the most important bit. If we like attempt the merit or distinction criteria without working on the pass criteria, then we won't get a pass grade. So first step is to do the pass criteria properly, then we'll move to the merit criteria, and then we will move to the distinction criteria. Don't ever think that if we work on the distinction criteria, then automatically we will like cover both the pass and the merit criteria. No, we have to work on the pass criteria first. Then the next step is the merit criteria, then the distinction criteria. So if we overall uh, like work on these criteria, pass, merit, and distinction, and we work properly, then we will get higher grades. We may get merit or distinction as well. If we only work on the pass criteria, then we will be only limited to the pass grade. So always try to get a higher grade in your assessments. So these all are the important aspects. And always like keep in mind that we always do the in-text citation and referencing. We follow Harvard referencing style. So we will make the in-text citation and the references according to the Harvard referencing um, principles. And for that, like in Harvard referencing, always keep in mind that the references list should be in alphabetical order. And we can use different websites like mybib.com or cite this for me. So we can use these websites to do the in-text citation and references as well. And there would be like few um, requirements, like you can say that to make or look our assignment or the assessment look good, we can include the uh, table of contents. Um, we can have font of Arial, and we can use Arial font and size 12. Also we could have line spacing of 1.5. So these all are the important aspects which we could try to achieve in our assessment, and that would give us higher grades. So any questions, please? No. Right. So we'll finish today's lecture then, and tomorrow we will discuss about the learning outcome 4, and next week we will discuss about the assignment discussion. And that's all for today then. And take care, everyone. Bye.